Testicular cancer is a rare but highly treatable cancer that develops in the testicles, the male reproductive organs responsible for producing sperm and testosterone. In this comprehensive guide, we will explore what testicular cancer is, the standard treatment options available, its seriousness compared to other cancers, the prognosis at different stages, promising therapeutics currently in the FDA approval process, the unique challenges it presents, FDA-approved medications for testicular cancer, and a list of organizations and resources that provide support for those undergoing testicular cancer treatment. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. What is testicular cancer? Testicular cancer is a type of cancer that originates in the testicles. It typically begins in the germ cells, which are responsible for sperm production. Testicular cancer is relatively rare, but is one of the most curable forms of cancer when detected and treated early. Standard of care treatments for testicular cancer. Treatment for testicular cancer depends on several factors, including the type and stage of the cancer, as well as the patient's overall health. Common treatment options for testicular cancer include orchiectomy. Surgical removal of the affected testicle is the primary treatment for most cases. Removing the affected testicle is often curative. Radiation. High-energy X-rays may be used to target and kill any remaining cancer cells after surgery, especially for certain types of testicular cancer. Chemotherapy. Medications are used to kill cancer cells and may be administered before or after surgery, depending on the stage and type of cancer. Stem cell transplantation. In some cases, high-dose chemotherapy is used in combination with stem cell transplantation to treat advanced testicular cancer. Seriousness. Compared to other cancers, testicular cancer is generally considered less serious compared to many other cancers for several reasons. High cure rate. Testicular cancer has one of the highest cure rates among all cancers, especially when diagnosed at an early stage. Effective treatments. Surgical removal of the affected testicle and subsequent treatments like chemotherapy have proven highly effective in managing and curing testicular cancer. Early detection. Testicular cancer often presents with noticeable symptoms, such as a painless lump or swelling in the testicle, making early detection more likely. Low mortality rate. The overall mortality rate for testicular cancer is relatively low, even for advanced cases that may have spread to other parts of the body. Prognosis for stage 1. Testicular cancer stage. 1 testicular cancer indicates that the cancer is limited to the testicle and has not spread to nearby lymph nodes or other organs. The prognosis for stage 1 testicular cancer is excellent. With the removal of the affected testicle, and in some cases adjuvant treatments, the 5-year survival rate for stage 1 testicular cancer is typically greater than 95%. Prognosis for stage 4. Testicular cancer stage 4. Testicular cancer indicates that the cancer has spread to distant organs or tissues. While stage 4 testicular cancer is more challenging to treat, it remains one of the more curable stage 4 cancers. On average, the 5-year survival rate for advanced testicular cancer can range from 70% to 95%. The specific prognosis depends on factors such as the type of testicular cancer and the effectiveness of treatment. Promising therapeutics for testicular cancer. Research into testicular cancer continues to explore new therapeutic options, including immune checkpoint inhibitors. These drugs, such as Keytruda and Opdivo, enhance the immune system's ability to target and destroy cancer cells. They are being studied for their potential in treating testicular cancer. Targeted therapies. Some targeted therapies aim to address specific genetic mutations associated with testicular cancer, offering more personalized treatment approaches. Precision medicine. Genetic profiling of testicular cancer tumors can guide treatment decisions and identify potential therapeutic targets. One place to research promising clinical trials for testicular cancer is onclive.com. The book Cancer Self-Defense 101. Quick tips to help you survive details. Many integrative treatments that are relevant to testicular cancer. Why is testicular cancer tricky? While testicular cancer is highly curable, it presents some unique challenges. Silent progression. In some cases, testicular cancer may progress silently without noticeable symptoms. Regular testicular self-examinations and medical checkups are crucial for early detection. Risk of relapse. Despite successful initial treatment, some individuals may experience cancer recurrence or relapse, emphasizing the importance of long-term follow-up care. Younger age group. Testicular cancer typically affects younger men, and discussions about fertility preservation and potential long-term side effects of treatment are important considerations. Psychological impact. The diagnosis of testicular cancer can have a significant psychological impact on individuals. Support for mental and emotional well-being is vital throughout the treatment process. FDA-approved medications for testicular cancer. While surgery remains the primary treatment for most cases of testicular cancer, chemotherapy is the mainstay for advanced or high-risk cases. FDA-approved chemotherapy drugs for testicular cancer include bleomycin etoposide, cisplatin, ifosfamide. These drugs are often used in combination, such as the BEP regimen, bleomycin, etoposide, cisplatin, which is a standard chemotherapy regimen for testicular cancer. Risk factors. Risk factors for developing testicular cancer include age. Testicular cancer is most commonly diagnosed in young and middle-aged men, with the highest incidence occurring between the ages of 15 and 44. It is relatively rare in older men. Cryptorchidism, undescended testicle. Men who had one or both testicles that did not descend into the scrotum at birth, cryptorchidism, are at an increased risk of developing testicular cancer. The risk is higher if the condition was not corrected surgically. Family history. A family history of testicular cancer, especially in a father or brother, may slightly increase the risk. However, the overall risk remains low. Personal history. Men who have had testicular cancer in one testicle have a slightly increased risk of developing cancer in the other testicle. Race and ethnicity. Testicular cancer is more common in white men, particularly those of Northern European descent, compared to men of other racial and ethnic backgrounds. Klinefelter syndrome. Men with Klinefelter syndrome, a genetic condition characterized by an extra X chromosome, XXY, have a higher risk of developing testicular cancer. Testicular atrophy. Conditions that lead to testicular atrophy, shrinkage of the testicles, may increase the risk of testicular cancer. HIV infection. Some studies suggest that men with HIV/AIDS may have an increased risk of testicular cancer, although the overall risk remains relatively low. Environmental factors. Some research has explored potential links between exposure to environmental toxins, such as pesticides or endocrine-disrupting chemicals, and an increased risk of testicular cancer. However, these associations are still being studied and are not well established. Infertility. Some studies have suggested a possible link between infertility and an increased risk of testicular cancer. However, the relationship is complex and not fully understood. Additionally, regular marijuana smoking is also associated with increased testicular cancer incidence. Organizations and resources for testicular cancer treatment. For individuals and families affected by testicular cancer, several organizations and resources offer support and information. Testicular Cancer Society provides resources, support, and educational materials for testicular cancer patients and survivors. Livestrong Foundation offers resources and support for cancer survivors, including those with testicular cancer. For more information, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.